off with Felipe Medeiros from Duke again. And Felipe, if you can just talk about maybe presenting a case in terms of how you look at this in terms of risk assessment. So thank you for being here, Felipe.
Great, thank you. Thanks everyone. Thank you, Ike. Thank you, Dave. Thanks, Ike, for the very nice introduction. And this is an interesting case. It illustrates corneal hysteresis as a risk factor in glaucoma. This is actually a patient of mine that I saw back. I was still in San Diego. And this is a 62-year-old male. He had a diagnosis of primary open-angle glaucoma and had been treated over time with medication and laser trabeculoplasty, and had pressures always on the low side, in the low teens, on maximum medical therapy. His corneal thickness were about average, 545 in the right eye and 541 in the left. And as you can see here, I'm illustrating here the left eye, you can see that he had pretty severe damage to the optic nerve. So this shows the nerves from 2003 to 2013. It's hard to see any changes here because the nerves are really quite already damaged. But if we look at the visual fields, this patient had a double arcuate defect. You can see on the baseline visual fields, and over time they show progression extension of that double arcuate defect. You can see here the Humphrey GPA analysis, and if you always compare to the baseline here, you can see that it's showing the triangles here showing the areas of worsening. Next. And over time, this patient showed progression, clearly progression, enlargement of those arcuate defects, despite pressures that were quite low and despite a normal corneal thickness. So it's an interesting case, especially because the corneal hysteresis for this eye was 6.1. So it's a very low value in this patient. And that, again, that brings the idea here of, illustrates the point of corneal hysteresis being a risk factor for glaucoma progression. So this slide here, I don't know if you do want to go over this already, or do you want to talk a little bit about the case?
Sure, Felipe. Actually, I think that would be. I think if you could review these two graphics, because these graphics I know have come from your work.
Yeah.
And if you can maybe just discuss what these show here, we get into the risk factors.
Sounds good. So these plots here, they come from a prospective study that we did, exactly looking at corneal hysteresis as a risk factor for glaucoma progression. So what we did, we had a cohort of about 110 eyes that we followed over time, and all eyes we got a corneal hysteresis at baseline, and we followed them over time with the purpose to see if corneal hysteresis was predictive of those eyes who would progress over time. And what you see here on the plots here on your left is that you see the slopes of visual field loss. And the eyes are divided here in eyes with low corneal hysteresis below the average and eyes with high corneal hysteresis above average. And you can see that you see lots of eyes in the low corneal hysteresis that were progressing, and some progressing actually quite fast, but you don't really see many slopes going down in the eyes with high corneal hysteresis. So there were essentially no rapid progressors actually in this group. And the plot here on your right is a plot that illustrates how a combination of corneal hysteresis and intraocular pressure helped explain the rates of change, helped explain the change in visual field over time. So in particular, the interesting thing to look is that a combination of low corneal hysteresis with high intraocular pressure was particularly harmful. So you can see in the area there of that you have the red curves. And the numbers, the little numbers that you see there, they were rates of visual field loss, the percentage of visual field loss per year. So let's say minus 3% per year, which is minus 3% per year may actually sound small, but actually you have to think about this in that it will accumulate over time. So if I have minus 3% per year, in 10 years, I lost 1/3 of the visual field. So it's actually an extremely fast progression. So low corneal hysteresis and high intraocular pressures were particularly harmful. If you actually had high corneal hysteresis, even when you had somewhat higher pressures, the rates were not particularly fast. So showing that corneal hysteresis was protective. So again, this plot here illustrates how the combination of low hysteresis and high pressure was quite detrimental and was present in those